Hi, I'm Jackie Mitchell with your Senior Advantage team. Welcome to your Senior Advantage. We have two topics that we'd like to talk to you about today. One of them is about home health care, and the other one is about downsizing and decluttering. We hope that you'll enjoy them. Hi, I'm Jackie Mitchell, and I'm with your Senior Advantage team. I'm here with Lynn Degenhart from Mercy Home Health. Hi, Lynn.
Hi, Jackie. Good to see you again.
Good to see you again. I know we're going to talk this afternoon about home health care.
Correct.
What is home health care anyway?
It's very diverse. There basically are two types of home care providers. There is what's called skilled home care, which is nurses, therapists, home health aides, social workers that would actually come into someone's home to provide those clinical services. Then there is what's called non-medical or companion care. And those would be individuals, caregivers coming into the home to maybe help with cooking, bathing, cleaning, shopping, personal care, things like that.
Oh, okay. What are the different types of home health care, or is that what we just talked about?
Yeah, the different types are the skilled and the non-skilled.
Okay.
And probably the biggest differentiation is the fact is how they're paid for. Skilled home care is covered by insurance, whether it be Medicare or another type of insurance. It's ordered by a physician, so there's very little out-of-pocket expense, if any.
Right.
Where the non-medical companion care is private pay, because it's an optional service that you're bringing into the home. So it can range anywhere from, I would say, $18 an hour to maybe $25 an hour, but that's all out of pocket. Non-medical home care does have the ability to be reimbursed by long-term care insurance if the participant has long-term care.
Is there a way to know what or why, when somebody needs to have that kind of
when you need
care or non-skilled?
Yeah, a lot of times people think that they have to be in a hospital or they have to be coming out of rehab to benefit or to be approved for skilled home care. That's not the case. Obviously, most people coming out of a hospital setting were there for a critical illness or a fall or something like that. So it's a very easy transition, and people think of it. Well, I fell, or I had a hip replacement. Of course, I need the visiting nurses to come out. Rehab the same way. You're in a clinical setting, so of course. What people don't realize is, let's say your grandmother or your mom is living alone in the home and she's fallen a couple times recently. At that point, the family member can actually call a home health agency such as Mercy or another and say, you know what, my mom isn't doing well. She fell recently. I'm not sure she's taking her medications, or she has a cardiac issue or pulmonology issue, and I'm just not sure she's doing okay. Can you come out? I think that's the biggest misconception, is that family members don't know that they can actually ask the physician for home care. And how that would work then, if they would call our office or any office, we would do a brief intake to see what's going on, what diagnoses they have, what's happening recently, and then we would call the doctor to get the order, if you will, kind of like a prescription.
Right.
Since it is reimbursable by insurance, then we have to follow those guidelines of having it ordered by a physician. Some of the other roadblocks, I guess, or just not familiarity, is physicians also can order home care. And this is something that most home health agencies are trying to educate physicians on. So if they have a patient coming into their office and they see a decline from the last time they were there, or new diagnoses, or new medications, or just cognitive, deficiencies that weren't there the last time, the physicians also can just pick up the phone and call a home health agency and get those services ordered in.
Oh, that's great. It's good to know that, because I don't think many people know that.
People don't know.
Yeah. And then are there other skills that skilled home health take
Like
care
what
of?
services do,
what are they?
skilled provide? Typically skilled nursing, so the visiting nurse, everyone's a visiting nurse.
Mm-hmm.
So the nurse comes out, and that nurse usually at every visit will do a medication reconciliation. They'll take the vital signs, and they kind of give the patient a thorough exam, if you will. There's also therapies that are involved. Physical therapy, everybody kind of knows what that is. You know, you have to walk or ambulate so far, or how do we do this, how do we do that, how do we get your upper body strengthened if you have lower body weakness. Occupational therapy, a lot of people don't realize how important occupational therapy is, but what that is teaching someone how to efficiently perform their activities of daily living. We call them ADLs. So how do you transfer when you get up in the morning to stand up, or to get in and out of the bathtub? Or how do you put on your socks if you've had maybe, you know, surgery or a stroke? So the therapies are really important. Speech therapy is for those that are starting to have swallowing difficulties, or perhaps somebody that suffered a stroke recently. The faster you can get speech therapy into a care plan, the better. Obviously, some people have heard of feeding tubes or peg tubes, and that's when someone loses that ability to keep food or fluids down. And what ends up happening is it kind of sits in this area and aspiration takes place. So speech therapy is an integral part of skilled home care. And some of the agencies, Mercy being one, actually has all of our speech therapists certified in what's called VitalStim. Some of your rehabs will do VitalStim, but VitalStim is a very dynamic and effective speech therapy tool to help retrain muscles. So for example, if everyone's familiar with, electrical stim, if you have PT or OT, they put the electrodes on your muscles and they start to pulse and they start to work, and then, you're strengthening those muscles. Very similar in the speech therapy VitalStim. There's strategic electrodes that are put on muscles in the throat, and then those electrodes start to pulse, and those muscles are working. And then you use traditional speech therapy, swallowing therapies, to retrain those muscles to keep food down. So, we personally have had 2 successes where some of our patients were on those feeding tubes that have actually had them removed. Because we all know, we all like to eat, we like to go out, it's a real social thing. So to lose that ability to eat, regular food and not on a puree diet or something like that is huge. So speech therapy is another part of the skilled home care. Home health aides. We have, all of the agencies have home health aides. So these aides would be an instrumental part in somebody that is struggling with some of those activities of daily living, like bathing, dressing. How do you transfer from a shower to outside? So a home health aide will come in and actually perform those functions and also teach, the patient and or the family how to do them safely. Another component to skilled home care is social work services. And a lot of times those services come in after our clinicians have been out because they see maybe some of the shortcomings that the family or that our patient have. Maybe they're entitled to services through the Area Agency on Aging. Maybe they need Meals on Wheels, or maybe they need transportation resolutions. A lot of times seniors especially are no longer driving, so how do you get them to the doctor? You can have 10 doctor's appointments set up, but if you don't have transportation, you're not going to get there. And I think a lot of the seniors hate to be a burden to their adult children. Right. So they don't tell their adult kids, I need a ride to the doctor. So what happens is they don't go. So these social work services can help link them to transportation, Meals on Wheels, community entitlements, and then also the ability to maybe link them up with senior financial planners or elder law attorneys, maybe for those living wills and power of attorneys that people, we don't like to think about them. But as you know, with your Senior Advantage team, it is crucial that people have durable power of attorney and documents like that.
Right. I've heard about home monitoring.
Oh, yeah.
What's home monitoring all about?
Oh, very exciting. Some of the viewers may or may not be aware of, but Medicare has really changed the accountability of hospitals. For those that have, say, admitted to a hospital, if they're readmitted to that hospital within 30 days for the same diagnoses, And I think right now there's 3 diagnoses that they're monitoring, but it's going to expand. That hospital does not get reimbursed.
Oh my goodness.
They're kind of looking at it like, maybe there could have been something else that could have been done in the hospital setting or in a home care setting. So quite a few of the home care agencies have what we call telehealth or home monitoring systems. And it's equipment that is put in the home. There is no cost to insurance and there is no cost to the patients or their families. But this equipment put into the home is hooked up to a phone line and it monitors their blood pressure, their weight, their pulse ox, their cardiac rhythms, and if they're a diabetic, their sugars. So every day, 7 days a week, 365 days a year, this resident hooks up to this system, little clip here, blood pressure cuff, stand on the scale for the weight, and their readings are monitored every day by 11 a.m. by a cardiac nurse at, I'll give our company example, Mercy in Springfield. There's parameters that are set by the physician, whether it be cardiologist or the primary care. And we start to see that, there was a 1 pound weight gain from yesterday to today. Or, now it's another pound weight gain. So we're able, or the home care agency is able to intervene to say, hey, what's going on? If they didn't eat well yesterday, maybe high salty foods or something like that, that will contribute. So we kind of know there's a cause and effect. But let's say, oh no, I've done everything, I've taken my meds. So a couple of things can happen. We'll send a nurse out. Or perhaps we have to call the physician to get maybe an order for a latex, something like that, kind of get rid of the fluid. Or maybe we have to get that patient to the doctor. Or maybe they really do need to go back to the emergency room. But the key with telehealth is the national average for rehospitalizations for those diagnoses, CHF, which is, cardiac failure, COPD, pulmonary issues, is 27%. That's almost a fourth of patients wind up back in that hospital setting. This is the stunning part. If telehealth is involved, that 27% drops to 4.8.
Oh wow, that's terrific.
Huge.
Yeah.
Huge for the hospitals, huge for healthcare in general, for Medicare. But most importantly, what we see is that the patients are learning and empowering as far as how to manage that disease. That if I do this, if I have a half a bag of Doritos and 2 glasses of soda, then tomorrow I'm getting a call from my nurse, like things aren't going so well. So it helps them manage and treat their disease process a little bit more efficiently.
I have one more question for you. Can a loved one receive skilled care in a nursing home or a community like personal care or assisted living?
Yeah, that's another thing that people forget. I hate the word facility, but that's what they're kind of known as. There's basically 3 or 4 types of facilities, communities, I like to call them, that are out there. You have the skilled nursing setting, which is where someone actually does require 24/7 nursing. They need to have people there continually. Their health condition is such that they really require that. Then the next step down would be assisted living. And for those of you that aren't aware, which probably no one is assisted livings have been broken out into 2 categories, assisted living and personal care. Assisted living has a little bit higher acuity capabilities for their residents. And then there's personal care homes. So like examples in this area, personal care homes would be like a Brightview Senior Living or Senior Suites, Sunrise Communities, Bluebell Place. Those are personal cares. In this area, assisted living, the closest one here is Columbia Cottage. So you have skilled nursing, assisted living, personal cares, and then independent living. So can home care come in? They can come into 3 out of the 4. So they can come into assisted living, personal care, and independent living. Skilled nursing care, again, since that's being paid for usually by Medicare or Medicaid, they're providing all those services. Now, the one thing that can go into a skilled nursing community is hospice. So if a resident in a skilled nursing facility does need that level of care, hospice, which is also a home-based provider in those situations, can go into skilled nursing.
Thank you very much, Lynn.
You're welcome.
Is there these services mostly covered by Medicare?
Yeah, Medicare, well, any insurance they're covered by. Medicare, it's considered part of your hospital benefit. One of the criteria for home care that I think it's important for people to know is that you do have to be what's considered homebound in the eyes of Medicare and the insurance companies. And so I wouldn't screw this up. I made sure I brought the official explanation. There exists a normal inability to leave the home, and consequently, leaving the home would require considerable and taxing effort. I think some of the misconception is that you have to be bedbound, that you can never leave the home to receive home care. That's not the case. You usually have to require the assistance of someone else. It's very difficult for you to leave. But that doesn't mean that you can't go to church. You know, you can still go to church and be considered homebound. Thank God for us, we can still go to the hairdresser, you know, maybe once every couple of weeks and still be considered homebound to receive the services. You can go to graduation parties. You can go, you know, when you have family reunions. So what we tell doctors, what we tell families is don't worry about that. If you think someone would benefit from home care, call the home care agency. Let us figure out if that person, your loved one, qualifies for the benefit. If they do, that's wonderful. We don't want families or doctors to overthink it. We're the experts in home care. Let us make the decision. If they're not appropriate for home care, then we'll link them maybe with community services or outpatient services.
Thank you very much, Lynn.
You're welcome.